As the great Hippocrates once said, all disease begins in the gut. Today we'll be diving into a common gut disorder that affects millions worldwide, gastritis. This prevalent condition is more than just a stomachache, it's a real issue that can have a significant impact on your daily life. Understanding gastritis is the first step towards managing it. In this video, we'll explore what gastritis is, its causes, symptoms, and treatment options. We'll also touch on steps that can be taken to prevent it. It's important to note that while this video provides a comprehensive look at gastritis, it should not be used as a substitute for professional medical advice. Always consult with a healthcare provider for personal medical needs. So buckle up as we journey through the workings of our gut and uncover the mystery of gastritis. First things first, what exactly is gastritis? Gastritis is a term that encompasses a group of conditions, all of which share a common thread: inflammation of the stomach lining. Now you might be wondering, why is the stomach lining so important? Well, it's because the stomach lining plays a crucial role in digestion. It's coated with a special mucus that not only helps break down the food you eat, but also protects the stomach from its own acid. Yes, you heard that right. Your stomach produces acid to aid in digestion, but this acid is so strong it could even digest the stomach itself if not for this protective lining. So imagine what could happen when this protective barrier gets inflamed or damaged. That's when gastritis comes into the picture. When the stomach lining is inflamed, it can't produce enough mucus to protect the stomach walls from the acid. As a result, the acid starts to damage the stomach lining, leading to the symptoms we associate with gastritis. Now there are several types of gastritis categorized based on where and how the inflammation occurs. Acute gastritis refers to a sudden inflammation that can cause severe symptoms, but usually resolves quickly with treatment. On the other hand, chronic gastritis is a long-term condition where inflammation occurs slowly over time. If left untreated, chronic gastritis can lead to more severe conditions like stomach ulcers or even stomach cancer. It's important to note that not everyone with gastritis will experience symptoms. Some people may go years without realizing they have this condition, but for those who do experience symptoms, they can range from mild discomfort to severe pain, and we'll discuss these in more detail in the next scene. Now that we have a basic understanding of gastritis, let's delve into what causes this inflammation. There are several reasons why someone might develop gastritis. Some may surprise you. One of the most common causes is the bacterium Helicobacter pylori, often referred to as H. pylori. This tricky little microorganism resides in the mucus layer of your stomach and can cause inflammation if it grows out of control. It's quite common around the world, and many people carry it without even realizing it. Now another unexpected cause can be long-term use of certain over-the-counter pain relievers, like aspirin and ibuprofen, or even prescription drugs for arthritis. These medications can weaken the protective mucus coating in your stomach and small intestine, making your digestive system more susceptible to stomach acid. Next up is excessive alcohol consumption. We all know that too much of a good thing can be bad, and this is no exception. Drinking alcohol excessively can irritate and erode the mucus lining in your stomach, leading to gastritis. Stress is another factor that can contribute to this condition, but we're not talking about the everyday stress of meeting a work deadline or getting stuck in traffic. We mean severe stress from major surgery, injury, burns, or severe infections. This type of stress can cause acute stress gastritis. Furthermore, certain other diseases and conditions can also lead to gastritis. These include autoimmune disorders, where your body's immune system mistakenly attacks the cells in your stomach. Other conditions like Crohn's disease and HIV/AIDS can also make you more susceptible to gastritis. And finally, gastritis can sometimes be caused by bile reflux. This happens when bile, a fluid made by your liver to digest fats, backs up into your stomach and inflames it. So there you have it. A wide range of factors, from bacteria to stress to certain medications, can lead to gastritis. It's a common condition, but one that shouldn't be taken lightly. Knowing the causes is half the battle. But how would you know if you have gastritis? Let's find out. Gastritis can be sneaky, but there are signs to look out for. It's a bit like playing detective with your own health, isn't it? But knowing these signs can help you pinpoint if gastritis might be the culprit behind your discomfort. First off, one of the most common symptoms of gastritis is abdominal pain. This isn't your run-of-the-mill stomach ache. We're talking about a gnawing or burning ache that's centered in your upper abdomen. It's the kind of pain that makes you pause, makes you take a deep breath. Sometimes it might feel like your stomach is full, even if you haven't eaten much. Then there's the nausea. It's like being on a roller coaster that just won't stop. You feel like you're going to be sick and sometimes you might actually vomit. It's not a pleasant feeling and it can be quite distressing. Other symptoms can include a feeling of fullness in your upper abdomen after eating and an unexpected loss of appetite. You might find that your favorite foods just don't appeal to you anymore. And then there's the indigestion. You might feel bloated, belch more than usual, and have heartburn. It's like your body is in revolt, and everything you eat seems to cause an uproar. But remember, gastritis is a bit of a chameleon. It can change its colors to blend in. Some people may not experience any symptoms at all, or they might be so mild that they're easily overlooked. This is known as silent gastritis. It's silent but potentially damaging, as it can lead to complications if left untreated. So, if you're dealing with any of these symptoms, the abdominal pain, the nausea, the loss of appetite, or the indigestion, it's time to stop playing detective and start seeking professional help. If you're experiencing any of these symptoms, it's crucial to seek medical advice. But what can you expect in terms of treatment? Stay tuned as we dive into that in the next part of our video. Thankfully, gastritis is treatable and in many cases, preventable. There's definitely a sigh of relief in that statement, isn't there? So let's get into the crux of the matter. The treatment for gastritis usually involves taking medications to reduce stomach acid, which can help relieve gastritis symptoms and promote healing. Doctors may recommend over-the-counter antacids, H2 blockers that lower acid production, or proton pump inhibitors, which also reduce the amount of acid your stomach makes. It's always crucial to follow your healthcare provider's advice and take these medications as directed. In addition to medical treatment, lifestyle changes can also play a significant role in managing gastritis and preventing it from recurring. This often means making healthier dietary choices. Consuming a balanced diet that's low in fat and high in fiber can make a world of difference. That means loading up on fruits, vegetables, whole grains, and lean proteins. Avoiding irritants like alcohol, coffee, and spicy foods can also be beneficial. It's like avoiding a pothole on the road. The less you hit it, the better your journey. Or in this case, your gut health. And speaking of journeys, quitting smoking is another voyage worth embarking on, as it can significantly improve your gut health and overall well-being. Stress management is another crucial aspect of prevention. Incorporating stress-reducing activities into your lifestyle, such as yoga, meditation, or even a simple walk in the park, can help keep gastritis at bay. It's the perfect excuse to finally start that mindfulness course you've been eyeing, or to simply take a few moments each day to breathe deeply and relax. So, there you have it. A blend of medication, healthy eating, and stress management can effectively treat and prevent gastritis. It's about taking a comprehensive approach to your health. After all, every part of you is interconnected and your stomach is no exception. Remember, your health is your wealth. Taking care of your gut is taking care of your overall well-being. So let's make a toast to good health and a happy gut. So, there you have it, a comprehensive look at gastritis. We've journeyed through the fundamentals of this condition, exploring its causes, symptoms, and the various treatment options available. Remember, gastritis isn't something you should ignore. The discomfort you're experiencing could be the body's way of telling you that something isn't quite right. If you're experiencing symptoms, it's crucial to seek medical advice promptly. A healthy lifestyle is the best defense against gastritis. A balanced diet, moderate exercise, and avoiding triggers like alcohol and spicy foods can go a long way in preventing the onset of this condition. But the most important takeaway? Never underestimate the importance of your gut health. It has a profound impact on your overall well-being. We hope you found this video helpful. If you did, don't forget to subscribe to our channel Vigor Vault. Give us a thumbs up and share this video. We'd love to hear which tip you found most helpful or any other health topics you'd like us to cover. Until next time, take care of your gut and it will take care of you.